know about COVID-19 so far?
Well, what we know is that this is the seventh corona type virus that can affect human beings. So we went through a SARS crisis back in 2009. So we have other types of coronaviruses. So the bird flu, for instance. But so looking at how those viruses, how they affected human beings, what can we say? Since this is a new virus for us, but it's not entirely new, meaning it's from a family of viruses. So what can we say about the other viruses? What can we expect in terms of outcome? Well, we should expect, even if people contract the virus, probably about 80% of the time, they're going to have mild flu symptoms. That's what we should expect. In terms of the worst case scenario, in terms of people dying, we should expect anywhere from about 1 to 2% may die. So, but we're not talking about millions and millions of people dying. I'm not sure what people are thinking, that this is going to be some kind of major plague or that we've gone through in the past. For instance, Spanish flu back in 1919. It's not going to be that way. So I mentioned 80% of the time probably we'll expect minor flu symptoms, 1 to 2% of the time. Some are even pushing that number a little higher, up to 5% in terms of a death rate. So what about the numbers in between? Is that about 18 or 15%? What should we expect? Well, more severe flu symptoms. Some of those people in that group will end up possibly being hospitalized. So, to me, there shouldn't be this incredible. Unfortunately, what's going on here, it seems to be a major type of a panic. We didn't have this panic with SARS. We didn't even, there was an emergency declared, but it was 1 year after SARS, and a total of about 1,000 people died in this country from SARS. So we should all actually be very concerned about other viruses that kill more people, like influenza. My gosh, 20,000 people at least die a year, and in some cases as high as 30,000. So no one's talking about that. So far, I'm so sorry that anyone is dying, but the thing is, just being realistic here. Where there are centers of concentration of this particular virus. It's not Chicago, it's not Illinois, it's Seattle, Washington, it's New Rochelle, New York. It's places like that. Many of the people who have died, we have actually died in specific nursing homes. So who's at greatest risk? Well, those with a compromised immune system. And that would include people who have cancer, who are on chemotherapy. People with HIV/AIDS, but people with compromised immune systems. Other underlying conditions would include, unfortunately, diabetes and cardiovascular issues, and certainly respiratory issues such as COPD, emphysema, even asthma. So those could be underlying conditions for potential patients. So that would make contracting this coronavirus more dangerous for them. So as I said, for many of us who are healthy, who don't have underlying conditions, even if we contract this virus, we should expect, we're not talking about death. We're talking about, most of the time, minor flu symptoms. However, the other fear is, even when we're healthy and we contract the virus, our other concern would be, well, then we could spread the virus to others. So are we spreading that virus to someone with a compromised immune system? That would be the real concern.
I agree.
Especially on a personal level, if we have elder family members with issues at home, or we visit them in an assisted living facility or a nursing home. So the idea of, you may have the virus, you may not even be aware it's causing much trouble for you, but spreading it to someone who actually has a compromised immune system, that would be that should concern us.
Absolutely.
So again, some simple precautions that we went over. Go ahead, take your vitamin D, D3, your vitamin C, wash your hands, be careful about physical contact, especially with, if you in fact have family members or friends who fall into the categories that I was talking about.
Thank you.